listening to Dr. Zink, like, do people have questions? I've got a few more things to share. And I'd really honestly like to open this up as a bit of a conversation because we have teachers, we have parents, we have teachers and parents, we have former teachers, we have a great uh, group of people here just to have a conversation. And I mean, this is obviously even larger than just a school conversation. I mean, it's just opportunity to have conversation about how do we do this more safely, all of those things. So questions for anybody or?
I just have a comment. My daughter works for the Anchorage School District, and right now just admin and some teachers are in getting things ready. Already, it's only been one day. Policies have changed in one day. So, like they said, snow days. I mean, I don't think anything's written.
You know what? I think that that's a really good analogy. I mean, I've got friends and colleagues, that teach or work in the Anchorage School District, and I think there's just been more. They've done maybe, I don't know if better is the right word. They've just kind of presented their plan, and I think that that's reassuring to people, even though they know like the plan's probably going to change. Here's the plan. Some of the frustration that I'm sensing and I'm hearing in Mat-Su is that, well, number one, we don't have a superintendent here yet, and that there's not like a plan. Like, it's kind of like, well, it's going to be up to each school. And Salita shared with me the letter that she got from the principal of Mockatons. And man, I thought that was nice, but there's a lot of like, we don't know, and we haven't made this yet, like that kind of thing. But it's a letter. And I think it's just more challenging when there's not like here's the plan coming out of Mat-Su School District. Like, I feel like there hasn't been a concerted effort, and part of that, I was shared some information in an email that got sent out, I know, to teachers last night, and I'll share my screen again. You guys, please feel free to like chime in as well with questions. But so, basically the Mat-Su Borough School District had the COVID-19 page. They have these frequently asked questions. Those are the community events. They will be at Friday Fling tomorrow. And then, and I'll throw something together quick and get it out to you guys, at least with the references I have. So basically some frequently asked questions as to what's going to happen with the school year reopening. The other thing I linked to is this Alaska, and they refer to this, the Alaska Smart Start 2020. And so this has basically been put out by the state, and it gives, this red, yellow, green concept, and it, it just talks about conditions of learning, continuity of learning, capacities, like how do we deal with all these things. But it's really it's a rough framework. So there's not a, there's nothing written down in stone because we don't know. Another thing that I came across and I alluded to, and I had shared this with you, another thing with you guys quite some time ago about resiliency and immune support. And so Dr. Lisa Song is a pediatrician that I have met through functional medicine and through a Mindshare that I'm in. And Elisa has taken the time to really talk about reopening schools from a pediatrician's perspective. And I think you guys will really appreciate this. And she addresses, like, how should schools reopen? We don't know. Nobody knows. And part of what I think many of you will appreciate, she kind of goes through all of these things like contact tracing, who's getting tested, and really one of the big issues that if we'd had Dr. Zink for more time, that we could have like really we probably could have hit her with a lot of questions, but it comes down to testing. With the Mat-Su Borough, it sounds like if there's a positive test in a school, the school's going to close for, I think it was 5 days until they can figure out who they're in contact with. Elisa really talks about a bit about you know, a lot of it is like, so gone is the day of give your kid some Tylenol in the morning and hope the fever stays down. Like you'll be fine, you can go to school. You know, like that's not happening anymore, clearly. And Elisa really talks about kind of something that Dr. Zink alluded to that was really cool is that 7-day and 14-day window, um, to give us an idea of what are the cases happening in the state. And I appreciated her going through that because I hadn't toggled through some of those screens to understand what it would represent. And so that's really cool. And Elisa talks about that R naught, and that's that, like, if I get it, how many people am I spreading it to, is that R naught. And in the US, it's never been below 1, you know, like one case ends up causing one other case. We've definitely been above that. But so she talks a little bit about that. How does that factor into schools? She also talked a little bit about, you know, we're worried about this distancing between kids in the schools, but also how you could, in depending how it's structured in a school, could it be that you could have a cohort of kids, you know, that are like, so maybe these 5 are together. So they're, you know, you're not trying to keep them 6 feet apart, that kind of thing. So, you know, maybe some of those things, I think it's going to take a lot of ingenuity this year and a lot of, you know, if anything pushes us to think outside the box, this is an opportunity. And, you know, we can learn really great things. Some things are going to be really cool to come out of it. Some things are going to be less ideal coming out of it. Elisa, she addresses kind of like, you know, some of the issues around socialization with kids. Do kids, interestingly, she talked about kids transmitting COVID-19. And she referred to 2 different studies in this, a Dutch study as well as a study out of South Korea. In the Dutch study, well, both studies actually show that kids under 10 don't end up being real transmitters. They have the lowest transmission rate. Those kids that are 10 to 19, probably some of the highest transmission rates. So that's really interesting. So like early childhood education, that kind of thing, that may be, we don't know for sure, but that may be actually safer, you know, than 10 to 19. So later elementary, middle, high school kind of ages in terms of transmission. But she also talked about kind of, you know, we have to think about things, which I know you guys are all thinking about, like how many kiddos have a parent that has a health issue, a grandparent, and how do you deal with your kids seeing their grandparents if they're going to school? What about kids that are in, you know, non-ideal situations, home situations where school is a safe place? You know, I think there's all those factors, and I think that's a lot of the stress for people is trying to figure out, like, wow, how do we do all of this? And really make sure that our kids are safe, that we can learn. You know, every family is different and every family structure is different, you know. Can people kind of be like, okay, you know, I like the analogy of like we took our family into the woods. Well, that's a little bit tougher in this day and age to check out. Not very many probably families are in a situation where they could do that. But it is interesting. The one other thing I wanted to share, and Dr. Song references this, and I haven't had a chance to go through the whole thing, but she really said she felt like one of the best thought out plans actually for school is Michigan Safe Schools. So that would be something to look at some point, and I'll make sure that you guys have links to all of these things to look at if you want, or refer to maybe your principal or whatever, if it's just helpful, just more information. But if I'm gonna go, I will stop share again, but like, does anybody have like more questions, comments, like this, you know, like I want this to be kind of an open forum. I had a few things to talk about, but really wanted to be able to I'd also like to learn other concerns for people so that I may be able to look into them. I certainly have access to Dr. Zink, so we can, I can try and learn things. And as many of you know, like, I mean, I'm happy to write letters to the school board, to do all of those things, to just to help support all of you guys, like with questions and concerns. And so if somebody has a question, please, you can unmute yourself, you can put it in the chat box, but this time's for you guys as well. No questions with all that? Did Dr. Zink answer them so well? Thoughts, comments? Yeah, thank you, Diana. I think that seems to be a frustration that I'm hearing, is feeling like maybe there's not consistent answers or communication maybe from the school district. But I certainly would say that sometimes I'm probably not the best in there. Good. Thank you. It sounds like there's going to be more information next week. I presume, I don't think there's a hidden agenda. I think people just don't know what to say. Helpful to know secretaries start Monday, and I think, part of it is too, the way that the district seems to be handling it, that it's school specific, which makes sense, but also I'm sure is some frustration because local schools know there's different demographics at each school, which people understand that. But I think, like the letter that Salita shared with me that came out of Makatons, I didn't have all the answers, but at least it was communication, and it was really nice. And I think as a non-parent even, I mean, I read it and was like, oh, okay, well, at least you get the sense that somebody's thinking about it, they're working on plans, and I'm hopeful that as maybe it's the secretaries coming back and people will start to put plans out. But also I understand, like, there's none of us have been in a pandemic before, and principals are now being put in a situation that they really have never been in, and being asked to create plans based on a pandemic. And I can only imagine some of them are like, wow, like I absolutely don't know, I don't know how much direction they're getting. And that would be a challenging position to be put in, I would suspect.
So we've tried to follow all the rules, in the last 4 months, the social distancing, keeping our bubble small, wearing masks, not going indoors if we don't have to, that kind of stuff. And we're really struggling with what to do with school, just because it feels like the second our children walk into school, all of that kind of goes out the window. From what we know, there will be some distancing, but it doesn't seem like it's kind of up to the guidelines. And they're not requiring masks. There's going to be things like choir and fitness classes where they're indoors with all these kids, and it just doesn't seem safe. And yet I don't feel like those concerns are being heard. So we're just really struggling with what to do. My husband and I are both working from home, and we'll probably continue doing that for a while. Homeschooling would be challenging, and we don't really like the options that are being provided to us for homeschooling. And if we choose our own program, I think my kids will lose their spot at school because they're in a charter school. So it just really puts us in a bad situation, I feel like.
Yeah, I totally agree, and I appreciate that. Thank you for all the comments, because I think that is like the fear for a lot of people. And when you just think about school, like, certainly at an older age, but I think that's more challenging because maybe they are concerned or they're not concerned. But little kids and smaller kids, like, how do you, like, it's unrealistic that they can distance. You know, it's kind of what Dr. Zink said about her younger child saying, well, I just don't even want to go because I'm not going to be able to do all these things that you're telling me I would need to do. And I think that is that's really a challenge. And I don't even know how that would be alleviated with guidelines. Really, I mean, unless we really end up on a downslide, and it will be very telling to see what happens in the next few weeks with numbers, with those kind of things. Like if all of a sudden our numbers started to drop off, I think a lot of us would feel maybe a little bit more reassured about it. But right now, when we are watching these cases go up in Anchorage, it really uh, make I mean it's concerning because yes, we've all been told to do all these things, and how many kids like still haven't even been in a grocery store since March? I mean, there's probably still some that haven't. And so how do you know, now to send them to school is like, oh my, like the grocery store would be small potatoes compared to going to school. So I agree. I don't I mean, the biggest things that I would say, you know, we have to do what we can to support our immune resiliency because it's here. And once we get through this pandemic, then we're going to have, there's going to be something else, you know. So really focusing, doing what we can to focus on our health, to focus on our resiliency is so important right now because this will, I mean, it kind of puts us in what, you know, a new norm. We don't know what the new norm is yet, and how does it work. And you know, we've seen in other countries where it seemed like kids have done okay in school. In other countries it's not working as well. So I think that's a challenge. um, so it will be very interesting. And if it's helpful, if we have a call in a couple of weeks again, we can do that too. And we can even through the fall how things go. Like I think, you know, this is going to be like the snow day analogy of Dr. Zink seems very appropriate, but from, I can only imagine from a parenting standpoint, and you know, having your own job and all of those things like that, there is a whole level of, uh, you know, there's just a level of functioning that like each of us with our jobs, that doesn't work like a snow day like school does. And you're dealing with people with jobs and all of those things because no job flexibility will be um, will be that dynamic like in dealing with kids in and out of school and how do we do that. So it will be interesting to see how this happens and throw in potentially the variable of people not getting tested or not wanting to get tested. Or unfortunately right now, if you don't have symptoms, you're not going to get tested. Or if you do get tested, you're going to be one of the ones that gets sent off to wherever and we don't get results for days, which isn't very helpful either. So I think that's a challenge. And if you're asymptomatic, is it really going to be a true, you know, a true negative test if it's a negative, or are we dealing with false negatives because there's not enough of a viral load. So I think unfortunately there's so many, we're trying to make these precise decisions with a bunch of really imprecise data points really, which is challenging. Other thoughts or comments? Well, I'll put the resources that I have. You have more resources. If any of you have resources that you think would be helpful for us to be able to share, please shoot an email to the clinic, and I can, maybe what I'll do is just kind of create a resource list for folks. And then certainly, obviously, if people have questions, please reach out. Whether it's through the portal, through the email, through a call. and we'll do our best to get answers or try to help support in whatever way we can. All right, well, everybody go get outside and improve your immune resiliency because it seems to be sunny at the moment. So just shout if anything else comes up, but otherwise, thank you all for joining this morning, okay? Thank you.
Thank you.